What if a new government mandate came out that said that you had to wear a fez and a bow tie in order to prevent the spread of COVID? Would you do it? Hi, my name is Ali Shoaga, and this is 10 Points to Ponder, where we like to talk about all the things that get you canceled: race, politics, Jesus, and manhood. Are we more concerned about the appearance of taking this seriously than actually doing it? Have we all become actors in a very dangerous game of what I like to call safety theater? Here's 10 points to ponder. Point 1, we shut down schools. We know that younger kids are at lower risk of getting COVID, but that doesn't matter. We've still shut down schools so that we can increase the achievement gap between poor kids and other kids. We can increase the amount of depression, and we can lock down our college students. The interesting thing is that the same public health experts that used to tell college kids it was okay to meet random strangers on Tinder are now telling them to cower because of COVID, because we all know that COVID is the only disease that we need to be afraid of. Point 2, through lockdowns, we've actually increased the number of homeless people. The University of Chicago says that 51% of people are 2 paychecks away from being homeless. The homeless population last year was 550,000 people, and out of that, 13,000 people died. The rate of death for homeless people is 2.3%. The average age of homeless people that die is age 50. The average age of death for COVID? It's 78 years old, which has been the average age of death in the general population for the past several years. Point 3, starvation and hunger. David Beasley, the executive director of the United Nations World Food Program, warned in June that 400,000 people had died from COVID, but that's a small number compared to the 300,000 that will die daily if lockdowns are continued. And how about in the US? If the unemployment rate increases to 10.5%, then 50 million people will be food insecure, which makes about 15% of the population that is in danger of hunger. A wise person once said that the cure can't be worse than the actual disease. Point 4, increased suicides. In September in Japan, more people died from suicide than died from COVID. And in the US, we don't know the statistics because they are 2 years behind. What I predict is that more young people will die from suicide than will die from COVID. And we're all supposed to pretend that there is no price too great to keep us safe from COVID. That's why we call this safety theater. Point 5, increased drug overdoses. I personally know a mother who was found by her child in the bathroom dead from a drug overdose. In Santa Clara County in California, in October, there were more fentanyl deaths than there were all of last year. And in Virginia, from January to June, there was a 39% increase in drug overdose deaths. And how are people getting these prescriptions? They're getting them from doctors over Zoom calls. But lest you become overwhelmed, remember, peasants, there's nothing to see here. We are staying home and we are staying safe. Point 6, we've increased alcohol use. We've closed gyms, but we've opened liquor stores. According to the CDC, 1 in 10 people between the ages of 20 and 65 will die of alcohol abuse. and total every year there are 95,000 deaths due to alcohol abuse. How many people became alcoholics due to the lockdowns, due to the stress and anxiety and joblessness? And basically what we've done is we've given them one disease in order to keep them from getting another. Point 7, you kept yourself from getting COVID, but you increased the number of divorces. According to Psychology Today, in August, there was a 35% increase in divorce filings. Also, children from divorce are 2 times more likely to attempt suicide and 2 times more likely to drop out of school. And for men and women who are married, they live 2 years longer than those who are unmarried. And for men specifically, when they get divorced, their early death mortality rate is increased 250%. But on the positive side, you didn't get COVID. Point 8, there's been an increase in child abuse. There has been nationally a 40% decrease in the number of child abuse cases reported. And a Florida study just found that in March and April alone, there are an estimated 200,000 cases of child abuse that went unreported. Internationally, in Australia, they found a 136% increase in online child sexual exploitation material. Our responsibility as adults is to take care of the children. How could we allow fear to keep us from fulfilling our greatest responsibility? Point 9, there's been an increase in domestic violence. In New York, there were 2 to 3 times more domestic violence calls to hotlines. And in Boston, doctors found that there was a doubling of the number of people that were going to hospitals for injuries consistent with domestic violence. And what's emboldened the perpetrators more is that courts have been closed. So we need to examine what the costs are of distancing ourselves so much from our neighbors that we allow these things to go on in silence. Point 10, in our grand experiment to keep all of us safe, we've actually increased the national homicide rate. The rate right now has increased by 36%. Let's take the top 3 in the nation comparing this year to last year. Philadelphia, 306 to 238 murders. New York City, 305 to 226 murders. The worst, Chicago, 524 to 345 murders compared this year to last year. And we might blame the protests and we might blame the move to defund the police, but all of these things are not understood properly outside the context of COVID lockdowns. Stop this theater. We need to stop pretending that COVID is the biggest thing and no cost is too great in order to prevent us from getting it. We have people dying of cancer. We have people dying of preventable diseases because either the hospital was closed or because they felt that they could not go to the hospital because it was crawling with COVID, which was media created. We need to live in reality and in common sense. But those are my thoughts. What do you think? Please like, comment, subscribe, and share this video. My name is Ali Shoaga, and this has been 10 Points to Ponder.